Hi Jim, I'm Lauren. I'm going to be your nurse today. There is a liver panel ordered for you. We use this to assess like the liver function and health. Have you ever had one of those done? No? Okay. So the first test inside this panel is ALP. The normal range is about 40 to 130. We use this to assess liver or bone disorders. And for any high levels, you might experience jaundice, bone pain, or itchy skin. For low levels, there might be numbness or tingling. And then factors that could affect the test are after eating fatty meals. And then before the test, we are going to fast. During the test, we are going to refrigerate the sample right after. And then after the test, we're just going to continue to monitor for any signs of tumors, and then you can go back to normal activities. So the second test is going to be total bilirubin. The normal range is 0.1 to 1.0. We use this to assess the liver function. Implications of this could be heart failure or hepatocellular jaundice. For high levels, you might experience jaundice, itchy skin, or fatigue. And then for low levels, that's clinically insignificant, so we're not worried about that. For any factors that could affect it, it could be certain foods such as carrots or yams, and then prolonged fasting or anorexia. Before the test, we are going to fast. And then during the test, we are going to store away from the light right after it's done being taken. And then after the test, we are just going to review those results with you. For direct bilirubin, the normal range is 0.0 to 0.3. We use this to check the bile duct for any blockages. Implications could be cancer of the head of the pancreas, and then any gallstones inside that bile duct. For high levels, you might see jaundice again, dark urine, and pale stools. And then for low levels, there's often no symptoms there. Interfering factors could be high fatty meals or air bubbles. Before the test, we are going to fast if possible. And then during the test, we're going to protect the sample from the UV light. And then after the test, we are going to review those results again. The next one is albumin. The normal range is 3.5 to 5.0. We use this to assess the nutritional and liver status. Implications of this is acute or chronic inflammation or cirrhosis. For high levels, you might see thirst or dry mouth. For low levels, you might see edema, wound healing, or fatigue. Interfering factors could be prolonged bed rest. Before the test, no fasting is required for this one. During the test, we are going to obtain like a 5 milliliter sample, and we're going to put that in a light green tube. And then after the test, we're just going to continue to assess for signs and symptoms of edema. For total protein, that normal range is about 6.0 to 8.3. We use this to assess the nutritional status and any chronic illnesses. The implications of this is liver disease or kidney disease. For high levels, you might see dehydration, fatigue, or joint stiffness, and then low levels, you might see edema, muscle wasting, and then brittle nails or hair. Factors that could affect this would be prolonged bed rest again. Before the test, we're just going to explain the procedure, and then during the test, we're actually going to take 7 milliliters of the sample. After the test, we are going to report and document these findings. The next one is AST. The normal range for that is 10 to 40. We use this to detect any tissue damage in the liver, heart, muscle, or kidneys. Implications of this could be history of heart attack or liver diseases. High levels might look like fatigue or weakness. You might have some upper quadrant abdominal pain on that right side, and then nausea or jaundice. For decreased levels, you might experience weakness, muscle weakness, fatigue, or low energy, and then difficulty with protein metabolism. Some interfering factors could be severe liver disease or diabetic ketoacidosis. Before the test, we are going to explain the test purpose. During the test, we're going to use standard precautions and avoid shaking the tube. And then after, we're going to monitor for liver and heart disease. The next test is ALT. The normal range for males is about 10 to 40. We use this to diagnose liver disease and monitor treatment for hepatitis. Implications would be alcoholic cirrhosis and heart attack. For high levels, you might see jaundice, loss of appetite, or dark-colored urine. Low levels, you might see fatigue or generalized weakness. Interfering factors could be therapeutic heparin. And then before the test, we are going to clean the area before drawing. During the test, we're going to obtain like a 5 milliliter sample and avoid shaking the tube. And then after, you can resume to normal activities, and we will continue to monitor for any liver disease. So that is all for the liver lab panel.